my name is Pamela Schult, and I'm a nurse practitioner with Prisma Health Endocrinology Specialist and Thyroid Center. And today we're talking about gestational diabetes. What is gestational diabetes? Gestational diabetes is diabetes that is just related to the pregnancy state, as insulin resistance is naturally higher in pregnancy. This can also be termed carbohydrate intolerance in pregnancy. Who is at risk for gestational diabetes? Women that have obesity at the beginning of pregnancy, women that have a family history of type 2 diabetes, advanced maternal age after age 40, as well as a history of polycystic ovarian syndrome, and certain ethnicities have a higher insulin resistance. How is gestational diabetes diagnosed? Gestational diabetes is screened for routinely in pregnancy between the gestational age of 24 to 28 weeks. And that includes a glucose tolerance test, and that would be followed by a 3-hour glucose tolerance test if the mother fails the first 1-hour glucose tolerance test. How can gestational diabetes impact your health? During pregnancy, gestational diabetes has a higher risk of maternal and fetal complications, including hypertension in pregnancy, preeclampsia, macrosomia, which is where the baby grows faster than expected for gestational age, and also carries a greater increased risk of developing type 2 diabetes postpartum, and also an increased risk of developing gestational diabetes in a subsequent pregnancy. How is gestational diabetes treated? First line is exercise and diet modifications, decreasing carbohydrates in pregnancy and eating a healthy, well-balanced diet, including protein and green leafy vegetables. If gestational diabetes is not well controlled on diet and exercise, then medications may be required to manage gestational diabetes in pregnancy. And the treatment would include insulin as the first line, and then metformin as a second line medication. Are you likely to develop diabetes if you have had gestational diabetes? There is a 50% increased risk of developing type 2 diabetes following a diagnosis of gestational diabetes within this lifetime. This can be modified by continuing a healthy lifestyle, such as healthy diet and including exercise at least 5 times a week for 20 to 30 minutes.